Hi, I'm Jess, and I have endometriosis, and I'm here today interviewing Anandi, who is our sex therapist. So the topic of this talk is on endometriosis and sex. So this month is Endometriosis Awareness Month. So endometriosis is where tissue similar to, but not the same as, the uterus lining grows outside the uterus. So it's commonly found outside of the uterus, but it can also be found commonly on the fallopian tubes, the bladder, and the bowel, and it's also been found in some people on their lungs. The current Endometriosis UK statistics suggest that the diagnosis time in Northern Ireland is now 9 years and 5 months. Endo can cause severe pain and is among the 20 most painful medical conditions. It is not just a bad period. People with endo often experience pain during sex and intimacy, and as it is a chronic condition, this can cause relationship strain. So that's what the topic of this interview is. If you think you may have endo, you should contact your GP, or you can look up Endometriosis UK on the web, or alternatively, Broken Vaginas Belfast on Instagram for more information. Are you ready?
There's another form of endometriosis that gets kind of mixed in with it.
Anomiosis?
Yes.
Yeah.
What's the difference?
So anomiosis grows typically within the womb. So it's not quite the same as endo, but it would be very, very similar, and diagnoses can often be mixed up.
Similar symptoms?
Very similar symptoms.
Okay.
I think most of them are the same off the top of my head. And it's usually treated by thinning the womb lining for anomiosis. But it's usually got the similar symptoms.
It's within the muscular tissue?
Yes.
Yeah, okay.
So, are you ready?
Yeah.
So I've mentioned how endo can cause pain during sex, and this often causes sufferers to feel guilt when unable to have penetrative sex. Do you have any advice?
Well, I suppose what I'd like to do is separate out intercourse, so penetrative sex, from just sex. So are we talking specifically about intercourse and pain with intercourse?
Yeah, so for myself, I'd often find that the pain caused by my endometriosis without intercourse can make me feel, or make me not want to have any form of sex. And then you can also, or I also experience pain during sex. So sometimes I think the worry of that sometimes also works to put you off it.
Okay, so if we're talking about pain without the intercourse, is that to do with arousal, or is it that it's pain that stops arousal?
It's pain that stops arousal, right. I'd say.
Yeah. So if we kind of separate those bits out, so if you have the more generalized pain with endometriosis, so let's just park that, and then you have pain that is as a result of the endometriosis, but through intercourse. Let's just talk about that. So that kind of pain can lead to what we call vaginismus, which is that nothing's going in there because you're expecting there to be pain, so you're all tense. So you're not just expecting, so you're not just tense because of the endometriosis pain, it's the anticipation of pain with intercourse. It's very tricky to manage that part, because if there is pain with intercourse, then we have to work out, well, when is the pain? Is the pain at specific times? And then not have, if it is at specific times, and not have intercourse at those times. So then you don't have painful sex. So once that message kind of gets through, and you can reduce the times when you have painful sex, then you kind of understand your body better. So you don't have intercourse at those times, but you can have intercourse at these other times when it's better. So then you can move yourself along away from vaginismus. Does that make sense? Okay. But if you have generalized pain with it because of the endometriosis, then you have to learn to manage the generalized pain in a generalized way rather than linking it with sex. You can then have other forms of sex that have nothing to do with intercourse or any form of penetration. And I think once you learn to manage that and you know how your body operates, then you can start to feel safe, I guess.
Yeah.
But you also, so once you know your own stuff, you can then share that with your partner.
Yeah.
Yeah.
So I think for a lot of women that are diagnosed with endometriosis, they can often feel quite guilty that they can't necessarily have sex all the time or engage in penetrative sex, because that's obviously what's expected of us with societal norms and things like that. So would you have any advice for sort of moving past the feelings that maybe you're failing or you're not fulfilling your duty as like a partner? Well, not duty, but
I think a lot of those feelings are common, not just with endometriosis. You know, just basically being tired and not having the same level of libido as your partner can lead to those same feelings of guilt and not being good enough and so on. So it's really kind of being able to look at yourself as an individual. What do I need? What can I manage? What can I cope with? And having that kind of conversation with your partner. Psychosexual therapy can help with all of that, especially if the communication between people has become stuck, and you feel your partner doesn't understand, or your partner feels that his understanding isn't getting through to you. But a lot of this stuff can be seen in the context of wider relationship issues too, libido and disparity of desire, so which is the difference in the libido of the couple. It's not exclusive to endometriosis. It's very, very common. I don't think I've met a single couple where their libidos totally match, Nobody wants to have sex all the time, even if society tells you that you should. Nobody does. If not, we wouldn't do anything else.
Cool. So that kind of leads us on to the next question. So often treatments of endo or the endo itself, as we've discussed, can cause libido loss. So I know you've talked about opening up a conversation, but is there any other ways that you can sort of cope with this within yourself or with differing libidos? Is there sort of any tips or tricks or ways to form a conversation that you would recommend?
So you have to look at is sex the only difficult thing that people talk about or not be able to talk about? Probably no. Education is really key. So learning about yourself, learn about your partner, just learn about sex overall. Learn about how your body responds. I mean, I think pretty much if we know that this period of time works for us, so I don't know, this particular week in the month, less hassle happens because there's not as much pain. You're more kind of interested at that point. That point, then your partner is going to be more keen at that point. I think generally when people know something is going to be more positive for them, it helps. If you have a partner who says, how about it? How about it? How about it? Would tonight work? They're just kind of looking for, well, when is it? And if you again keep saying no, no, and you feel guilty about saying no, no, then that creates this kind of friction. Whereas if you can come along and say, there, and there, I'm good, your partner will probably go, oh, right, there, and there, good. Make a date.
Okay, cool.
Does that answer your question?
Yeah, I think so, yeah. I suppose the only thing then maybe would be, endo can be quite a fluctuating condition.
Yeah.
So sometimes you think something's going to be fine and then it's not. If there's kind of that expectation that something's going to be okay on that date and then it's not, how would you kind of advise to deal with that kind of, to avoid sort of disappointment for both parties?
I think the same thing is what your expectation is. If your expectation is that you will have intercourse, even though you have a fluctuating system, then you need to change your expectation.
Okay.
If your expectation is that you'll just kind of be able to get together and get your kit off and have a little bit of skin-to-skin contact, that's a much nicer expectation. Very little failure rate on that. So it's, what do you expect to happen? You know?
Cool.
It's food and sex, in my mind, link very closely together in analogy. If I go to a restaurant and I expect to have a 3-course meal, and I find that, I'm too full after the mains. I couldn't be bothered with the dessert. Am I going to force feed myself the dessert just because I went there with the expectation of a 3-course meal? Or am I just going to do the thing that I can manage?
Cool. Very good. So I think the next question then is, some endo patients will be advised to use dilators to help with pain during sex. What are these? How do they work? And do they really help?
Do they help? Don't know. Dilators are useful tools in managing vaginismus. And you get different levels of vaginismus. So sometimes very severe vaginismus is when absolutely Zippo can go into your vagina. Then you have other levels of vaginismus where it's painful and painful not tolerable. And then you have painful, a little bit more tolerable, and then just basically uncomfortable. So those are grades. And it can vary. Where the dilators come in and they're useful is in confidence building. So if you know that you can allow yourself to relax enough for this finger-sized thing to be inserted into your vagina by yourself, by the way, great. And you do that and there is no pain, grand. And then you increase size and length and there is no pain. And you can gradually then build up because they come in different sizes and girth and length. So it's about confidence building and basically allowing yourself to relax and to be able to build up tolerance for something in there. Because most of this stuff is that you're anticipating pain with intercourse, therefore you get pain.
Yeah.
So it's a reinforcement cycle. Yeah. So if you can do something at your own steam, at your own pace, and learn to relax, and you can put something in there, and then you can increase the girth and the length, and you do that gradually, and there is no pain, you've then learned to relax. And then you can transfer that knowledge then when you're with a partner. They come in different materials as well. So you get ones that are made from silicone and you get ones that are made from perspex. They're quite hard. I call them lollipop molds. But the perspex ones, they have a handle, so nothing can get lost up there. They're a little bit cold, but there are ways you can make them warm, like put them on a hot water bottle and stuff and just get them warmed up. The silicone ones, well, silicone's much more pliable. It's more like skin. It feels more like a penis. So they're different ones, and they have ones with curves on them. So yeah.
So interestingly, actually, Broken Vaginas Belfast did a post about sex toys and endometriosis and different sex toys that can help. And actually, from the research, one of the ones that came up were the glass perspex dildos. So I wonder if actually in a dilator form, apparently the cold can be quite soothing.
Okay.
I don't know. But I wonder if maybe in a dilator form that also might help with.
Might, yeah. It's possible that people find the cold soothing because the cold might be a distraction for your brain. Yeah. But the real technique of using dilators is to relax your muscle. Deep breathing and all of those things help. Yeah. But endometriosis, it's really, I think, as a baseline, it's learning what your own pattern is around your menstrual cycle.
Yeah.
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 and thinking of sex in a much broader way. Sex doesn't equal intercourse. That's the thing.
Very good. So I think that kind of brings us to our last sort of big question. So endo can cause partners to feel disconnected, and from the diagnosis to prior diagnosis. How can couples work through this to feel closer?
So again, I think it's communication and keeping your partner in the loop, educating your partner as well as yourself. Um, and partners don't understand your pain; they understand their own pain. And that's the same with anybody. You can tell me you've got a toothache. My toothache will always feel worse than yours. That's just the way we are. Um, So educating your partner on what endometriosis is, maybe even taking them to GP appointments and stuff with you, that might be useful. But also communicating with them about what works for you sexually and listening to what works for them. So partners in some ways get a little bit of bad press because, well, we think they might want intercourse and they think they might want intercourse. But if the only time we get together is to have intercourse, then that's what sex becomes. Again, sex equals intercourse. Doesn't have to be that. Might be sometimes when you can do it. But I think most guys don't want to cause their women partners pain, you know. Skin to skin contact is where everything kind of starts, intimacy at a very, very basic level. Um, Mutual masturbation, oral sex, none of those require penetration. And so if you're okay with those things, you're both getting something out of it. There's still that connected piece there, but the communication really needs to be on mark. Yeah.